Hello and welcome to the Unit 7 presentation on cardiac function for nursing fundamentals. These are your learning objectives for circulation. Please familiarize yourself with them and be able to answer them in preparation for the class and for the exam. Objective K asks you to review how blood circulates through the body. So oxygen is carried by the hemoglobin in the blood to the peripherals, and then the oxygen-depleted blood is carried back up to the heart by the superior and inferior vena cava. The depleted blood gets carried through the right side of the heart to the lungs for reoxygenation. The now oxygen-rich blood is then carried back to the left side of the heart and pumped out to the peripherals again. The cardiac output is simply the amount of blood pumped by the heart per minute. The cardiac output is the product of the heart rate, which is the number of beats per minute, and the stroke volume, which is the amount of blood pumped out of the heart per beat. So CO equals HR times SV. The cardiac output is usually expressed in liters per minute. The heart moves about 3.5 to 8 liters of blood per minute. We need healthy heart tissue, properly functioning heart valves, mobility, and adequate blood volume to ensure normal cardiac output and tissue perfusion. There are several lifespan considerations affecting circulation. Some factors are modifiable and others are not. Modifiable risk factors are things we can change. These include smoking, nutrition, sedentary lifestyle, obesity, and stress. Non-modifiable risk factors are things beyond our control. We can't change them. These are family history, gender, personality types, among others. So take a few minutes here and just think about and name some non-modifiable factors that could cause an increased risk of heart disease in our patients. Objectives N, O, and P relate to assessment findings associated with circulation problems. This can be seen with changes in vital signs, such as a blood pressure less than 90. This is a serious sign of decreased cardiac output, and we need to not ignore this. With pulse rate and character, a diminished or absent peripheral pulses is a sign of decreased perfusion. Changes in skin color could signify a lack of perfusion. Hair loss, thickened toenails, all these things are affected by circulation. And then decreased cardiac output could be seen from an MI or heart attack, valve dysfunction, dysrhythmias. Altered blood flow is seen with dehydration or excessive fluid volume. And then atherosclerosis and venous pooling as well. And then decreased tissue perfusion is seen with tissue ischemia in things such as peripheral artery disease or thrombus, which is deep vein thrombosis. And ischemia just means lack of oxygen. So as we begin our assessment, we look at risk identification. Things like previous cardiac events or issues, such as CABG, which is coronary artery bypass grafting surgery, MIs, stents, and deficits from these problems. Modifiable risk factors. These can result in lifestyle changes for the patient, so the patient may resist this if this is presented as something they need to do. Also, intake of saturated fats, cholesterol, sodium. It is beneficial to have your patient describe their normal daily intake so we can get a feel for what they're eating, whether it's nutritious and healthy or not. And then we also assess activity and exercise patterns. Then also prescription or over-the-counter meds or illicit drug use. And this is really important because patients can experience an MI from coronary spasming related to cocaine use. So what happens is they present with an ST elevation MI, but then when they go to the cath lab, their coronary arteries are clear, there's no blockage in them, but they still have this heart attack with this damage. And what happens in that case is the damage is caused from the coronary spasms, because when those coronary arteries are clamped down, the heart's not getting oxygen-rich blood to it, and those coronary spasms are caused by the cocaine use. We also want to inspect our patients. How do they look? Altered cognition is an indicator of decreased perfusion. Do they have edema, central cyanosis, peripheral cyanosis, diaphoresis, changes in hair distribution on their lower extremities or arms, or is there neck vein distension? This can signify fluid overload. We want to palpate. Are they warm, dry, cool, clammy? What's their pulse rate and quality? What's the rate and regularity of their rhythm, their heart rate? If they have an irregular rhythm, check apical and peripheral pulses at the same time to see if all beats are perfused. We want to check daily weight to assess fluid retention and check capillary refill. We want to auscultate. Check a blood pressure, apical pulse, heart tones. Normal is S1, S2, and abnormal would be murmurs, rubs, or gallops. And then what lab tests are predictors of heart problems? Well, we check a CK, a CKMB, and a troponin. And these are proteins released from cells when tissue breakdown occurs. So an elevated troponin signifies heart ischemia, but just know it can also be elevated in dialysis patients also. A pro-BNP increases when heart muscle is overstretched, and this can indicate fluid overload. And then we look at an electrolyte panel, and we're looking here for sodium, calcium, magnesium, and potassium imbalances. And then we look at a CBC. We're looking at the hemoglobin because oxygen is carried through by the hemoglobin. So a decreased hemoglobin can be a problem for oxygenation. And then other diagnostics include EKG, echo, chest x-ray, stress test, or angiogram. Now this slide lists different nursing diagnoses, interventions, and outcomes. A few examples of nursing diagnoses include decreased cardiac output, ineffective tissue perfusion, and activity intolerance. So what does the NOC and NIC stand for? That's noted on this slide at the top of the right-hand columns. Well, if you're not familiar with that, NIC is Nursing Interventions Classification, and NOC is Nursing Outcomes Classification. And then this slide lists some possible goals. So for example, the patient will maintain adequate cardiac output would be appropriate for someone with circulation problems. Additionally, we would write SMART outcome criteria for the plan of care when we got to that point in our nursing process. We next implement our nursing interventions. And these interventions focus on health promotion and preventing impaired circulation, the ones that are listed specifically on this slide. And then this slide lists interventions that focus on treatment of impaired circulation. So let's talk for just a minute about chest pain. How is it treated? Well, we treat it using the acronym MONA, which is M-O-N-A. This stands for morphine, oxygen, nitroglycerin, and aspirin. So the reason these are chosen is because morphine and nitroglycerin dilate the coronary vessels. This is the arteries that feed the oxygen-rich blood to the heart directly, and allow better perfusion to the heart. So if those vessels are clamped down, that heart is not getting blood flow to the muscle that it needs to get. And so we give these medicines, it opens up the coronary vessels, and then that allows the heart tissue itself to get the oxygen-rich blood. Oxygen we give because this increases oxygen supply to the heart. Aspirin we give because it prevents platelets from sticking together and making blockages worse. So those are the 4 hallmarks of treating an acute heart attack, or not necessarily an acute heart attack, but treating chest pain if we suspect it's cardiac in nature. And then we also want to use edema reduction measures, and this is things like elevating the edematous extremity. If it's a pulmonary edema situation, we might set the head of the bed up so they can breathe better. Sodium reduction, fluid restriction, and then compression with the use of like TED hose on the feet. And then finally, we evaluate the nursing care plan and modify it as we need to. Were the goals met, not met, partially met? Are the interventions and goals still appropriate for the patient? If these things aren't the case, then we need to modify the care plan and we need to come up with something just a little bit different. And then just a little safety reminder about abnormal findings. So if you notice any of these things on your patient when you're at clinical or when you're practicing your job, you need to report these right away. We don't want to wait until the end of the shift to deal with these problems. These abnormal findings require an immediate follow-up because they signify that the patient's deteriorating or they're going to be deteriorating soon. And a problem is much easier to prevent than to treat once it starts going poorly. So quick follow-up and interventions for these types of things might save your patient's life. So just keep that in mind. And this concludes the presentation on circulation. Please be sure to view the oxygenation presentation before class. Thanks and have a great day.